Danielle get us started, and then I'll jump in a few minutes.
Okay. Jenny, I guess I'll just do a next slide.
Sounds good.
um, Good to, actually, could you go back? Sorry.
Yep.
It's good to be here with you all. I'm Danielle Varda, the CEO and founder at Visible Network Labs, and really pleased to have made this much progress at this point to be um, on the other side of our thinking that we've and planning that we did with a lot of you on the call. So I wanted to start with a big thank you for the folks on this call who gave us their time and expertise to help us think about how to do this project and then participated in it, was part of actually the contract and planning of it all. So lots of people on this call who have already made a big impact in that way. So thank you so much. I'm joined by Jenny today and Andy Zhang, who both worked on this project. And we've really enjoyed working with Bing, who has led this work and given us really great kind of guidance and way forward. What we've been working on is an effort to map the Cancer Survivorship Resource Referral Network in Colorado. And so today we're presenting a lot of the findings from this, knowing that this is continued work in progress. What you'll see throughout this is that we really did a ton of work to get as much as we could in this data set right now, and there's room for this to grow and continue to contribute to it. So excited about that. Okay, next slide. I'll just tell you a little bit about Visible Network Labs. We are a Colorado-based company, woman-owned company. Our tagline is to make invisible networks visible. So we know that there are lots of connections happening across individuals, and also organizations, but that they're really hard to see. And when we can't see them and understand them, it's very difficult to leverage them and improve and strengthen them. So we've really seen the power of the visualization of these, which is informed by really strong data measures and variables. So all of that kind of ties together in a way of us doing our work. Next slide. This is our project team, and just a couple of notes here, like about our company. Our mission is to strengthen social connectedness, but we do that by using network science as our foundation. And our team is made up of half data scientists and then half technology folks who include product people and developers. So what makes us really unique is we are really focused and obsessed with the measurement of ecosystems and their mapping, but also how do we actually translate that into tools that communities can use so that data get right into the hands of the people who want to use it. And so we have focused really intensely on how do we measure these things, and then also how do we actually translate them into practice. Oh, next slide. So that platform that we have built is called the Partner CPRM. And the CPRM is an acronym that stands for a Community Partner Relationship Management System. And you'll see on the right some screenshots. But basically, this is an ecosystem data tracking and learning platform. And it includes the strong measures that I talked about, a place for us to put all of the members of ecosystems in there, and then do analysis and visualization and reporting right in here as well. The tool has many different uses, from internal only to completely public facing. And usually our project leads decide kind of where to draw that line. A lot of it has to do with governance around data sharing and identification and of data in the platform. So you'll see today the data are very anonymized. We cannot see who is who. That's intentional at this stage, so that we're really protecting the privacy of people who answered questions, while also trying to leverage the data for action steps and strategies and translation into building a stronger referral network for cancer survivors. We do use this orientation around network science, so I'm just going to mention it really quick. Because it matters for us and in a little bit of it's what makes us different from like a traditional CRM, which is a customer relationship management system. A CPRM is really built around the concept not of selling and converting customers and marketing funnels, which CRMs are designed for, but more how do we actually understand who are the members of the ecosystem and their interconnectedness. So we talk a lot about this network way of working, which is really just a kind of norm now that most people, I'm sure you all are familiar with. We're all asked to do our jobs, and on top of it, connect with others, be a part of community coalitions. And in this world, what we're really curious about is how cancer centers are connecting with community resources. And so it's our goal to try to understand the nature of those relationships, how much they occur, what they look like when they occur, and even just one-to-one who's connecting with whom. And then on the next slide, you'll see a map of a network. And I bring this up because we actually call these referral networks and ecosystems, we refer to them as networks because we measure them, and we measure them as nodes and lines. And so the nodes are the circles, and those circles are represent organizations, and in this case they can just be people, and then the lines between them represent the relationship between the nodes. And so you'll see, so there's three types of data that we looked at in this project, and one is who are the members, which are the nodes, and the second, which is what are the relationships between them, which we framed as referral relationships. So we were interested in things like how many times do you refer patients or survivors to these referrals, community referrals. And then we also, the third type of data are these attributes. So how do we actually characterize the members of the ecosystem so that we can make sense of their connections and relationships? So the example of that is here as well. I think at this, so Jenny, as you go through it, sorry, I usually I'm doing it, so there's animations in it that Jenny probably didn't know about. So Jenny, you can just go through it until you get to your next slide. So I'll go ahead and pass it off here to Jenny, who led the project, to do more details about the method and the results of it. So Jenny, I'll just pass it back to you.
Thanks so much, Danielle. So, our general purpose when we started this work was really to map the ecosystem of resources for cancer survivals in Colorado, and to really understand the referral pathways that are connecting survivors to these resources, from cancer centers out to like community organizations. And to do that, we built a customized instance of the partner CPRM, and we used that as our tool for collecting, storing, mapping, analyzing, all that good stuff. And you'll have a chance in a minute to see one of the dashboards that came out of that work. But the basic process that we used for this was compiling and uploading a list of members of this ecosystem, which included both cancer centers and like community resources in Colorado. And I will tell you that that was by far kind of our most interesting and complex part of this process, was really trying to like find, comprehensive lists of cancer centers and the resources that they might be connecting with. And I know there are a few people on this call that helped us with that task. So we really appreciate that. It helped tremendously with moving this work forward. And then in partnership with Bing and Karin, who's no longer on this project with us, we developed a set of questions that really focus in on understanding, the cancer centers themselves and the connections that they have through referral relationships to community resources. And then, we fielded that survey. And as a result, we were able to learn from 17 cancer centers about those resources that they refer to, and the types of kind of characteristics of those referral relationships. So we're excited to dig into those a little bit more. But you might be thinking at this point, okay, well, how am I going to use this? What are the ways that we might use this to inform action? A few kind of key things that came up as we did this work were really kind of identifying barriers to the service and potential gaps in services available to cancer survivors across Colorado, but also identifying the strengths in those services and where there are, strong and persistent referral relationships. And also we've done a lot of work here to characterize those relationships to understand like their quality, their length, where did they come from? And so all of that can really help to start building, data-informed strategies as we think about, what tools might be helpful in our toolbox for supporting cancer survivors into the future. And we want to invite everyone to look at some of the deliverables that came out of this work. Our first one here is our live dashboard. So that has active data from the project in it, presented as charts and graphs and all that good stuff. So if you're somebody that really likes just like a brief snapshot of some data, that's a great thing to take a look at. We also put together a policy brief about this work. And a full report. And so each of those get into kind of increasing levels of detail about what we've done and how we did it. And I'll put those links in the chat for you all. But please feel free to kind of browse through these as we go through the presentation. This full report here on the end, that is really our most comprehensive piece. So if you really want to see like every question that was asked and all the data related to it, we also go into some follow-ups, breaking down data a little bit more by geographic region in that report. So if that's something that's interesting to you, please feel free to jump in there and take a look. And of course, as we go on, you're always welcome to post questions in the chat. So don't be shy about that. But now we'll get into kind of our key findings here. There are a few things that we want to focus on. First is just kind of a general overview of the cancer centers and resources, and then we'll dig into the services they offer and perceptions of those services, and then the referral network itself, duration and frequency of referrals, and then some of the challenges and gaps that were identified when connecting survivors to resources. So we'll start with just identifying, who's in this ecosystem and what do we know about them. So in that process of setting up the ecosystem, as Danielle sort of mentioned, we populated our database with cancer centers and also community resources. So we identified 92 cancer centers in Colorado in total. So lots of cancer centers. And we also identified 117 community resources, and we got those through talking to lots of folks who work in this area and compiling publicly available lists and lots of different resources. There is some overlap between these two groups. So some cancer centers also serve as resources and vice versa. And then we heard from 17 of them, which I know on our end was a real, felt like a real success. This is connecting with clinical organizations, as you all probably know, can be really difficult. Providers are all super busy. And so we're super excited about just the level of data we were able to get. And we were able to learn about almost 340 referral relationships. So lots of different data to look at here, and we'll unpack some of that as we go along. In terms of where the cancer centers that we heard from operate, we had some cancer center representation from across.
Okay. So you having to come back then?
Let's see.
Oh, someone might have to mute.
Yes. Oh, there we go. Okay. So we asked the cancer centers to report about where they serve across the state, and we mapped that into the RAY regions for Colorado just to kind of split this up a little bit. It probably is not terribly surprising that we saw, a lot of representation, in this more urban part of the state around Denver and some of the surrounding counties. But we also saw, responses from cancer centers that serve across the state pretty broadly. So, it's always hard, with a state as large as Colorado. Obviously, there's a lot of diversity geographically, and there's probably always more that we can know. And I think, it would be great as a next step to think even more about, how we could learn more about the rural parts of our state. But we had some coverage that kind of got us some insights into the geographic kind of distribution across our state. So what services are cancer centers and community resources offering? First, we can look at our community resources. So this chart represents the services that cancer centers are referring survivors to community resources for. And community resources meaning like any type of community organization that is providing some kind of resource to survivors, or could be. And we saw that most commonly, the resources that folks are getting referred for are either financial support services or some kind of support group. We saw, very infrequently that they were getting referred for things like rehabilitation services and physical activity programs. But they did sort of run the gamut here of different types of services that could be available. And then we also asked cancer centers to report the services that they provide to survivors. And you'll notice that this list looks a little bit different than the one you just saw. It has a few more entries, and that's because there were certain services that we knew cancer centers are kind of more likely to be providing. So that's things like screening for new cancers and treatment summaries. We didn't have any real expectation that they would be referring someone out to get something like a treatment summary. So there are a few things that only really cancer centers could do that we asked them about. And we saw some alignment between the cancer centers and also the community resources and things like financial support services being really high. And on here, we also saw rehabilitation services were pretty low. So that sort of aligns with what we saw in the community resources, and also that seminars for survivors were not quite so common among the cancer centers. And I think what's interesting is, if you look at these top two bars here, financial support services and then formalized referrals, you'll see that they come up in the next chart that I want to show. And this is where we ask the cancer centers to report on their perceptions of the availability of services in their community. So we ask them, is there too little, just the right amount, or too much of the following services in their community? And these were the same services that we asked them about in terms of what they provide. And interestingly, we see some alignment here between the things that they offer most frequently, so those financial support services and those formalized referrals, and what they perceive to be lacking in terms of the resources in their community. So I think that sort of maybe points us to a potential gap and something that we see. One, that cancer centers they're doing a lot of work in this area, and also that maybe they feel like it's not quite enough. On the positive side, we see a lot of agreement among members that there is the right amount of support in their community for screening for new cancers and screening for cancer recurrence. So there are some things that it sounds like are going really well, and then there's sort of a distribution in here of different types of services where various cancer centers felt like there was not quite enough for the needs that they are observing. So in terms of the resource referral network, I want to kind of break that down a little bit, and we'll get into some really fun network maps in a minute. But first, just to kind of think about, where do these relationships come from between cancer centers and community resources? We looked at the origins of referral relationships. We saw that most commonly relationships were formed either through word of mouth or through the some kind of National Cancer Organization website. So I think this is super interesting that it really is, more than anything, the power of that interpersonal relationship, right? That cancer centers and the folks that work there are just learning about these resources through other people in their communities. But also that there's a lot of value that comes from things like National Cancer Organization websites. So that tells us sort of where do these relationships come from. In terms of the kind of level of those relationships or how involved they are, we asked a question about what we call relationship intensity. And so that involves a scale that goes from awareness, which is kind of the lowest resource intensity type of relationship you can have. We kind of just know about each other. We might share some information, all the way up to, integration, which is, maybe you have a very formalized relationship where that's denoted by, maybe some kind of shared documentation. And then there's kind of coordination and cooperation as more kind of intermediate levels of intensity. And what was very interesting in this referral network was that we saw that overwhelmingly relationships occurred at that awareness level. So cancer centers, reported mostly that their relationships were pretty low intensity, focused on awareness. So that does leave a lot of opportunity for more kind of formalized relationships or potential to strengthen those relationships. But it is, in terms of resource intensity, it can be really helpful to have relationships kind of lower on this scale because they're often easier to maintain over time. But sometimes you can get, different types of gains, achieve different goals from getting a little bit higher on this spectrum. So something to kind of consider. And each of these little maps in here actually shows which relationships in the network reflected those different levels of intensity. And now, my favorite part of this, really looking at this data, is kind of putting all these nodes onto a map and seeing what the relationships look like when we overlay them with a geography. So here we see, we only surveyed organizations that are in Colorado, but we can actually see that their referral relationships reach across the whole United States. They're all kind of referring to partners in lots of different places. I think another interesting thing to note here is that, it's not that there's necessarily one cancer center that refers to a single organization, outside of Colorado. It's, oftentimes many of these organizations out of state we're seeing multiple referrals to them. Multiple cancer centers are making referrals there. So I think that says something about some of these national organizations, that they're, fairly well known and known across Colorado among cancer centers. But we can also dig a little deeper and look just at Colorado. And you can see here what it looks like within the state. And you can kind of see that concentration around like the Denver area. Lots of nodes, lots of ties around there, but also we can see some of these ties that are reaching out to other parts of the state. And here we color coded our nodes. So the red ones are cancer centers. These little green ones are both cancer or community resource organizations, and the ones that are purple are both. And these are actually sized by the number of relationships they have. So if they are more connected in this network, they're bigger. And so you can see, some of these really kind of big players that are doing lots of referrals, really kind of concentrated around the more urban parts of the state. And this background here is colored by the level of percent rural in each of these blocks. So as it gets darker, it's more urban, and as it gets lighter, it's a little more rural. So you can kind of see here, there's definitely an opportunity, I think, to continue learning more about the more rural parts of the state. But you can kind of see that there's still this sort of distribution, and especially when we're looking at networks, we can see how even those more urban connections can reach out into rural spaces as well. And we asked each of the cancer centers to talk about the confidence they have in their in the value of the referrals they make to survivors. And I think super interesting to see that overwhelmingly cancer centers have a lot of confidence. They feel either confident or very confident in the resources that they're referring survivors to, which is great. But I think it's also really interesting when we look at the network map itself. So you can see there were just a few that said they were not so confident in their relationships, and those really are just limited to a couple of cancer centers. It's not, they're not really distributed throughout the state. So it's kind of interesting to see, most cancer centers have a pretty high level of confidence in most of their referrals. There's only just a couple that are, maybe a little unsure. And then we can dig in even more into those relationships between cancer centers and the community resources they refer to. So we also asked about just how long these relationships have lasted, and I think a really promising finding here is that many of these relationships have been long-standing between cancer centers and the community resources they refer to. So most of the folks that we talked to said that they had this relationship for more than 5 years, and you get even up to 80% when we include those that are between 2 and 5 years. So they're pretty long-standing relationships. Again, you can look at this network map to see how those are distributed, and you can see most of the cancer centers that responded, felt pretty strongly in the same way that they had these long-standing relationships. But we can also contextualize that in, how are they activating those relationships? And we see that generally speaking, cancer centers they're not making a high volume of referrals to the community resources that they're engaged with. So most of the referral relationships have included 5 or fewer referrals for survivors to each resource. So I think that kind of is an interesting data point in the context of the length of time that they've had these relationships. So maybe that says something about the capacity that cancer centers have, that they're able to provide a lot of services themselves, and that they know when it's appropriate to send folks out to a community resource. But certainly kind of opens the door for maybe thinking a little bit more about why that might be. And we can see there's just a few that are making a pretty high volume of referrals to specific resources. And then, our final section is really focused on the challenges that we identified in serving survivors and what potential gaps might exist in serving across the different populations that cancer centers encounter. So we asked them very directly, just, what are the barriers and challenges for serving survivors? And we saw, overwhelmingly folks brought up the lack of transportation as a real barrier in serving survivors. But also that was followed up by a lack of an integrated health system and then not having enough personnel or staff. So I think these are things that, we hear really frequently when folks talk about, healthcare and clinical services, but I just want to bring up that these are things that we're seeing, patterns that we're seeing again in this space. The least frequent barrier that came up was health misinformation, but it was still fairly common at 43% of respondents. And then in terms of actually connecting survivors to resources, we asked the cancer centers to report on how confident they feel or how successful they are in connecting different populations to the resources they need as survivors. And we saw a couple of things that were interesting about that. So first was really that kind of the lowest levels of success or the lowest perceptions of success in connecting survivors came up among refugees and immigrants, folks who are not, don't have housing, and folks who don't have documents. So those were kind of, again, sort of high priority populations to think about in terms of making those connections, because we see that there's some uncertainty about being able to be successful in supporting them. We also saw a high level of uncertainty in connecting survivors who are pregnant and those who are farm workers. So there, some cancer centers felt like they were successful in making those services available and connecting them, but a really high number said that they weren't sure about whether they were successful in connecting those groups to the resources they need. So, that just, of course, maybe raises an opportunity to, build capacity and make sure that there's maybe a closed information loop there so that they can kind of figure out like where are they being successful and where there might be opportunities for growth in the way that they bring folks to resources. And I'll just conclude with a few kind of key insights just to summarize and a couple of potential steps that might be helpful to follow up on. So I think, first, we see that cancer centers are offering and referring survivors to a wide range of different services, but we do see that there's this perception that some of those might be lacking. So that includes things like formalized financial supports and formalized referrals. But we also see, lots of referral relationships are really longstanding. There's a lot of confidence in those referrals, but they are kind of low volume. We don't see lots of survivors getting referred to each of the resources that we highlighted here. And a lot of them are at that awareness level in terms of relationship intensity. So there's still kind of that open door opportunity for maybe building up those relationships more, finding different ways that they might build value by increasing that intensity a little bit. And then in terms of those gaps and challenges, again, we see, transit and integration and personnel as kind of key issues that cancer centers are running into when they support survivors. And then the perception that they are maybe less successful in serving immigrant and refugee populations, folks who are unhoused and undocumented, and then again, that uncertainty about whether they're able to effectively serve pregnant people and farm workers. So those are all kind of key insights that came up from our perspective. And a few, potential things to think about in terms of next steps for this work. If your interest is piqued and you have curiosity about this data, we have this whole ecosystem set up, so there's always the opportunity to explore it further. This is really just the beginning, and if you look in our reports, you can even see, the different ways that we've broken this data down, further by geographic regions and building out some different types of crosstabs, things like that. I think there's just always more. There's always more to know, and everybody has different types of questions that come up. So that's always an opportunity, but also we have this infrastructure has now been built, and so it's also possible to consider capturing additional data across, more cancer centers to continue to learn about this and to kind of fill in some of the details of that picture, so that we can get that broad view of the whole state of Colorado, especially in the more rural regions. And I'm gonna pause there and just say thank you and open the door if anybody has questions or comments or things that really